So we're on hypothyroidism now. So how should I assess a person with suspected hypothyroidism? This is a very good question. So earlier I told you guys about hypothyroidism and how it links to sort of cardiovascular and the heart. So if a diagnosis of hypothyroidism is suspected, you assess the person and arrange investigations in primary care. So you can do TFTs, so thyroxine function tests and stuff like that. So ask about typical symptoms of hypothyroidism. So here, this sentence right here will get you 1 mark in the exam. I hypothesize, they will ask us about symptoms of hypothyroidism and hyperthyroidism. That's my belief. I could be wrong, but who knows? So current or recurrent pregnancy, as a lot of thyroid medication is contraindicated in pregnancy. A main example is the medication used for hyperthyroidism, so used for Graves' disease. So carbimazole is used for Graves' disease, and that can cause congenital malformations. That is a very, very, very important point. So any current or recent non-thyroidal illness, and here it says do not check TFTs. We need to understand what they mean by non-thyroidal illness. This could mean many, many things. Any drug treatment such as amiodarone, lithium, or OTC supplements such as biotin may affect TFTs. So guys, I want to focus on this. Biotin may affect TFTs. So biotin is a supplement that can be used in hair. You find it in a lot of vitamin supplements for men's health or even women's health. So biotin may affect thyroid function tests, and that's a very important point to remember because the Gphc do quiz about supplementation and supplementation's effect on medication. Any other risk factors associated with hypothyroidism, such as family history of autoimmune disease. As you can imagine, a autoimmune disease may affect the parathyroid gland, which depends heavily on calcium levels. So calcium is important for parathyroid gland health, and that is something that you need to keep in mind. So personal history of pernicious anemia or alopecia areata, type 1 diabetes, and vitiligo. Anyways, these ones are not that important. So that's sort of iodine deficiency, obviously, that's very, very important. Examine the person for any goiter. So sometimes in the GPAC exam, you'll see goiter, but they won't necessarily ask you anything about it. It's a phrase that you may see. Goiter is simply thyroid enlargement. Very, 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 very crucial. Check the serum TSH level using clinical judgment to interpret TFT results, especially if the TFT results do not match what they're clinically presenting with or their symptoms, you know. So if the TSH level is above the reference range, what would that mean, guys? If TSH is high, that means you have hypothyroidism, as you can see here. Suspect a diagnosis of primary hypothyroidism if TSH levels are above the normal reference range and T3 and T4 is below the normal reference range. So guys, TSH is inversely proportional to T3 and T4. So if you have hypothyroidism, you will have a lower T3, T4 and high TSH. This is a very, very, very crucial point. Now, let's go down and see what else there is. Consider checking additional blood tests if primary hypothyroidism is suspected, a full blood count and serum B12 level. When you look at full blood counts, you need to imagine antipsychotics. You need to give a full blood count with certain medication like antipsychotics, and serum B12 level should be linked to metformin by now, guys. So FBC and serum B12 level is done to assess for pernicious anemia, and HbA1c is for diabetes. We know now that 42 to 47 HbA1c is pre-diabetes. 48 and above is diabetic, and that's the target if the patient has tried diet and lifestyle factors and they're on one medication that is not associated with hypoglycemia, not. If you've tried diet and lifestyle management and they are taking one medication that is associated with hypoglycemia, such as sulfonylureas, then the target is 53. Very, 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 very crucial points. So consider checking serum thyroid peroxidase antibodies TPOAB. So I'm going to skip over this because I don't see this in exams. So interpreting TFTs, be aware that TFTs may produce misleading results in certain clinical situations, and this is very, very, very important. Adrenal insufficiency may be associated with elevated TSH levels that reverse with glucocorticoid replacement. So a wide range of drugs may interfere with TSH secretion, production, secretion, and transport of thyroid hormones or absorption of T4 from the gut. So I'm going to keep the video short, guys, and